Can you share with our listeners what if any, kind of limitations there are on how that money is used or when it's used?
Right, so there were the language in the statute. This was the CARES Act, the large economic relief package. That package that set up the coronavirus relief funds did have some language around how the money was required to be used by state and local governments. Last week, the U.S. Treasury Department published guidance, more detailed guidance on how those dollars can be used, specifically the $1.25 billion here in New Hampshire. And $1.25 billion is a pretty significant amount for New Hampshire. And the guidance provided relatively broad latitude for COVID-19 crisis-related costs. And that's both the increased medical expenses, so for example, temporary facilities to care for people, as well as economic costs. So what are the costs associated with some of the social distancing and the physical distancing measures that have been put into place, and what's some of the economic repercussions of that? These dollars can be used for those items generally. However, the funds can't be used to offset state revenue losses due to that economic impact. And that's a big challenge for states. States, unlike the federal government, most states have a balanced budget requirement and have to balance their budget within certain time periods. In New Hampshire, we have a 2-year budget. Many states have a 1-year budget. The fiscal year for many states is ending June 30th. So with the revenue shortfalls that we've been seeing and are likely to see going forward, not being able to use those coronavirus relief funds to offset state revenue losses has big implications. Also, the funds can't be used to fund the state portion of the Medicaid match. And that again would allow states to then sort of backfill or at least offset increased Medicaid costs, and the funds cannot be used for that. So in New Hampshire, we have a situation where we're talking about using $1.25 billion in funds, which is a significant amount of money that will probably be put to very good use, because there's a lot of both medicals or health-related and economic costs associated with this, while also trying to find ways to reduce expenditures or increase revenues to balance a budget for which, for spending on basic services that were already agreed to last year in budget negotiations. So it's an interesting situation.